Hello everybody and welcome to my video regarding blood pressure monitoring. Today I will be discussing what blood pressure monitoring is, how it is done, and why is it done. So my name is Antonio Marian and I hope you learned something from this video presentation. So we will be tackling 4 different topics today. Objectives of BP monitoring, its methodology, how do we do it, result analysis, what did we learn from it, and the conclusion. So for our introduction, what is blood pressure? Blood pressure is the pressure of blood pushing against the artery walls. This is measured using 2 numbers, your systolic and your diastolic. Systolic means the pressure in the arteries during each heartbeat, and then diastolic would be the pressure in the arteries in between the beats. So when we write down our blood pressure, our systolic pressure is the number at the top, while our diastolic pressure is the number at the bottom. So why do we do it? Blood pressure monitoring is important in assessing the immediate condition of a patient. It is a good early indicator of declining health, especially for hypertension or hypertensive people, because in some cases, when it is left untreated or unmanaged, it can lead to serious health problems, increasing your risk for stroke, for heart attack, and those kinds of stuff. Hypertension does this by increasing the workload of the heart, thereby straining it. So this is the categories of blood pressure according to the American Heart Association. So we have our normal, our elevated, our stage 1, stage 2, and then our crisis. So how do we do blood pressure monitoring? This is a simplified version of the aneroid sphygmomanometer that we use whenever we take our BPs. So it has 3 main parts: the aneroid manometer gauge, the cuff, and the inflation bulb. So this is a more detailed description of our sphygmomanometer. But as I said, the 3 main parts are its gauge, the cuff itself, and then our inflation bulb. Of course, to do our auscultation method or auscultatory method, we would need our stethoscope. So what do we do before the procedure? There are 3 main steps to it. So we have to greet and introduce ourselves to the patient. We have to inform and get the consent of the patient to do the test. And then, unlike other tests, in BP monitoring or in cardiovascular assessment, we do auscultation first, followed by inspection, and then palpation. So let's go over it one by one. Why do we have to greet and introduce ourselves? So this is often overlooked, especially in the hospital setting, because of the amount of patients that nurses or doctors get every day. They sometimes forget to introduce themselves in order to move faster or to do their tasks faster. But as everything else, it is important to greet your patient and to introduce yourself. A simple greeting of hello, good morning, or hello, good afternoon. My name is Prixie Antonio. I am a medical student, or I am a medical doctor, medical intern, whatever. And I am here today to take your blood pressure. It gives the patient some time to assimilate the fact that you are somebody who is there to help and not just another face in the crowd, basically. So after you greet and introduce yourself, you have to inform them of the procedure that you are going to do to them and to get their consent to perform that procedure. It doesn't matter if it's just taking their blood pressure or taking blood from them or anything. You have to inform them of what you're going to do and get their permission to do it. So why do we do it? Why do we need to inform them, and why do we need to get their consent? We do this so that the patient is knowledgeable or at least aware of what you're doing to them. They know why you have to do it, and they know how you're gonna do it. So Hi, ma'am, sir. My name is Prixie. I am a medical intern and I am here today to take your blood pressure. Or kung Tagalog man yung pasyente natin, magandang umaga po, magandang tanghali, ma'am, sir. Ako po si Prixie, medical intern po ko. Kukunin ko lang po yung blood pressure ninyo. Okay lang ho ba sa inyo? Bali, kukunin ko po yung, hiramin ko po yung braso ninyo. Tapos, lalagay po natin tong cuff doon. Tapos, papalubohin ko po. Medyo hindi po siya, medyo masakit po, pero hindi naman sobra. Mapapansin nyo lang po na parang humihigpit, pero wala naman po masama mangyayari sa inyo. Okay lang ho ba sa inyo na kunin ko yung blood pressure ninyo? Wala naman ho ba kayong issues na ako yung kukuha? If they say no, or if they say hindi, okay lang, then you're good to go. However, if the patient tells you na, ay, natatakot ako, pwede ba antayin ko yung kasama ko, ganito, ganyan, then you have to, if the situation is not very urgent, then give the courtesy to allow the patient to relax and wait for his or her companion. Why? Because we are taking, specifically for this case, we are taking blood pressure. If our patient is nervous or if our patient is fearful of us, then of course the blood pressure would not be accurate. Okay? So the last point, auscultate, inspect, palpate. So, in other tests, which we will learn in the coming weeks, we usually do inspection first, palpation, and then we do auscultation. However, in cardiovascular assessment or in blood pressure monitoring or in blood pressure assessment, we have to auscultate first. Why? Because our goal is to accurately assess the blood pressure of the patient, the rhythm of the patient's heart. Now, if we were to do inspection and palpation first, obviously, the patient, the heart rhythm of the patient or the heartbeat of the patient will not be as accurate as it is after they have been rested, because we already did different tests on the patient. Obviously, the blood pressure is going to move, either going up or going down depending on what we've done to the patient. So we have to auscultate first so that we can accurately assess the heartbeat of the patient or the heart rhythm of the patient. So I'll be presenting you a video of what to do before we take the blood pressure.
Hi, my name's Simon. I'm one of the final year medical students. Can I just check your name and age, please?
Yeah, my name's Andrew and I'm 25.
Nice to meet you, Andrew. Today I'd like to take your blood pressure, so that will entail me taking this cuff, inflating it around your arm, feeling and listening to your pulse. Does that sound okay?
Yeah, that's fine.
It might be a little bit uncomfortable, but it shouldn't hurt.
That's all right.
Are you okay for me to go ahead?
Yeah.
Lovely.
So next, what do we do during the procedure? So we have two methods. I'll be presenting two methods, the auscultatory and the palpatory method. So how do we do auscultatory method? So we first, you have to have the patient be comfortable. They can either lie down or they can sit down, but you have to make sure that the patient has rested for at least 5 minutes or 10 to 15 minutes prior to reading. When we are taking the blood pressure, we must avoid using paralyzed injured arms or those with IVs and shunts, as this can affect your blood pressure or your reading. So once the patient is comfortable, you have to make sure that the arm, if the patient is standing or if the patient is supine, then you have to make sure that the arm is supported and elevated at the heart level or around the chest area, so that it's not too low or it's not too high. Now, making sure that making sure that your cuff is not inflated, you have to place it snugly about 1 to 2 inches above the elbow bend. Okay. Use the appropriate size of cuff. we have cuffs for different age groups. We have a cuff for neonates, we have a cuff for children, we have a cuff for adults, and for those, we also have cuffs for different parts of the body. So we have one for the thigh and for the arm. This is an arm cuff for adults. As you saw a while ago in the materials, our cuffs usually come with a gauge holder. So place your gauge holder there so that you can see it when it is placed on the arm of the patient. It's hard to see, but yeah. You can also place it down on the table if you feel that it's more comfortable for you. Some even hold them in their free hand, but it's best to just put it on the gauge holder because that's how it was intended to be by the manufacturer. Okay. After that, you have to place your stethoscope. You have to look for the brachial pulse. Once you find your brachial pulse, place your stethoscope diaphragm over it and underneath the cuff. Do not place your stethoscope over your cuff because it will interfere. Okay? So once that's already set up, and you can hear the brachial pulse, you have to begin inflating the cuff to about 120 millimeter mercury, and then you have to listen. If you can still hear the pulse or the heartbeat, you have to pump another 30 and then listen again. You have to keep doing this until the pulse is no longer heard. After that, you begin to, once you've reached the pressure where you can no longer hear the pulse, you have to begin slowly deflating the cuff by releasing your valve. Slowly deflate the cuff while listening for corot cuff sounds of at least 2 consecutive heartbeats, and then listen for the disappearance point of the pulse. Okay. So the corot cuff sounds mark the systolic pressure while the disappearance marks the diastolic pressure. So what are corot cuff sounds? Corot cuff sounds are the tapping sounds heard as the cuff is gradually deflated. Basically, what we're aiming when we say to listen for that corot cuff sounds, what we're aiming for is to measure the point or pinpoint the pressure upon which the pulse is heard again, or the tapping is heard again, which is your systolic pressure or your systolic mark, and then where it disappears again, or your diastolic pressure. Okay. Once you find those two, once you find your systolic and then your diastolic pressure, you record it using the millimeter mercury unit and then deflate the cuff. Okay? Fully deflate the cuff. So here's a video presentation of how that part is done.
Number. So what we're going to do is we're going to put our cuff on our patient, and we want to make sure we find the brachial artery. This is the artery we palpate that we'll be using to determine our blood pressure. And it's found in the bend of the arm. So we're going to find it, and it is located here. And we're going to look on our cuff, and our cuff has these arrows. And because this is the left arm, we're going to make sure that this arrow is pointing in that direction of where that artery is. So you're going to put the cuff up about 2 inches above the bend of the arm. First, what we want to do is we want to estimate the systolic pressure. So we want to find that number. To do that, we're going to palpate the brachial artery, and we're going to inflate the cuff until I no longer feel the brachial artery. And at that point, when I no longer feel it, I need to make sure I'm looking at this gauge to know that number, because that number is our estimated systolic pressure number. Then when I go to take the blood pressure, I'm going to inflate the cuff 30 millimeters of mercury more than that estimated number. Now, the whole reason for doing that is because we want to avoid missing the oscillatory gap that can occur in some patients. Not all patients have it, but some. And it's usually patients with hypertension, because the oscillatory gap is like this abnormal silence that can occur, and it will throw off whenever you actually hear that first sound, which is your systolic number. So I'm inflating the cuff while feeling on the artery, and I'm going to note the point where I no longer feel the artery, which is about at the 100. Then I'm going to deflate it completely and wait about 30 to 60 seconds, and then we'll take the blood pressure. So our estimated systolic number is 100. Now I'm going to inflate the cuff to 130, and that will avoid missing the oscillatory gap if one was present. So I'm going to take my stethoscope, put it in my ears. You can use the bell or the diaphragm of your stethoscope. I like to use the bell because it's best at picking up low-pitched noises. So we're going to place that over the brachial artery. Do it lightly. Don't fully compress it because you can occlude the artery. Then we're going to inflate our cuff to 130 millimeters of mercury. And we're going to let it fall about 2 millimeters of mercury per second. And we're listening for that first sound, which is our systolic number. Okay, it's 104. And we're listening for that last sound. And it was 78. So the blood pressure is 104 over 78.
Next, for the palpatory method. So the palpatory method, this specific method that I will be presenting you is the one where you do not use your stethoscope, or this is a way to measure blood pressure that can be used in an emergency situation, or if you are in a noisy environment. So, same procedure as the first. Have the patient be comfortable, rested for at least 5 minutes. Do not use paralyzer. And then placing it not inflated. Okay, close the valve. The difference, in the auscultatory method, we were listening to the brachial pulse. For the palpatory method, we are going to be using our radial pulse. Okay, so our radial pulse. Now, while palpating the radial pulse, as you can feel it, you have to begin to pump the cuff until the pulse is no longer palpable. Once it is no longer palpable, you pump for an additional 30 millimeter mercury. So after that, you begin slowly deflating the cuff while feeling for the pulse. Once the pulse is palpable again, you have to note that measurement. So that pressure is your systolic pressure. So this specific method, without using your stethoscope, can only give you your systolic pressure. Okay, it cannot give you the diastolic pressure because you will feeling your radial pulse will not give you an accurate point where the heartbeat ends. Remember, for our carrot cough sounds, we were listening. Carrot cough sounds denote your the start of your systolic and your diastolic pressure. So carrot cough starts, your systolic is the start of where the sound begins, and then diastolic is where the sound disappears. So here you can only feel your pulse and not hear what's happening. So it cannot give you a specific diastolic pressure. So how do you note the result? Whenever you're reporting this, you would write your systolic pressure above, over. So for example, 120 over letter P, which would denote that this is a blood pressure taken via the palpatory method. So here is a video presentation of how that is done.
This is how you palpate a blood pressure. The reason for palpating a blood pressure is primarily because you cannot hear or auscultate for a blood pressure. sometimes in the back of a noisy ambulance, this is impossible to do. So this is one way we can at least get a portion of the blood pressure. The only thing this will represent, though, is the systolic. We will not get a diastolic during this procedure. First, locate the radial pulse. Making sure your patient is in a comfortable seated position. Expose the arm. Place this blood pressure cuff, again, over the brachial artery. Feel for a pulse again, a radial pulse. As I pump it up, I will continue to feel it, and at the point where it goes away, I'll add about 20 or 30 millimeters of mercury, and then slowly allow the air to release. At the time the pulse returns, there is my systolic, and I'm done. This is only going to give me the top number or the systolic. And the way you'll represent this on your documentation is to put whatever number the systolic is, we'll say 120 over a P to indicate this is by palpation.
So now, what do we do after the procedure? So of course, first things first, you have to thank your patient. Maraming salamat po. Tapos na po tayo. Maraming salamat po sa pakipag-cooperate. Thank you very much, ma'am, sir, for your cooperation. Now, if the blood pressure is abnormal, you have to recheck the other arm, but wait for 1 minute before you do so. Then you have to document your results. If you repeated it, document it as well. If it is still abnormal, you have to consult with a supervisor or with someone higher than you regarding your results. Okay. So here's a video presentation of that.
That completes the procedure. Thank you very much, Andrew.
Thank you.
So now, what did we learn from it? So as I stated a while ago, we have our categories for blood pressure. Normally, adults ages 20 to 30 would fall under the normal range, having a blood pressure of 120 over 80 or less. Anything above that would constitute an elevated blood pressure. So, having a systolic pressure of 120 to 129 and a diastolic of less than 80 would be considered as elevated. This can be due to non-pathologic reasons, but it can also be an indicative of the start of a pathologic condition. So when do we say that the patient is hypertensive? That is when their systolic pressure measures at 130 to 139, or if their diastolic is between 80 to 89. So now, if either one of those conditions is met, that is already indicative of stage 1 high blood pressure. Stage 2 high blood pressure would categorize blood pressures having a systolic of 140 millimeter mercury or higher, or of a diastolic pressure of 90 millimeter mercury or higher. Now, hypertensive crisis, this would indicate a systolic pressure of higher than 180 and a diastolic of higher than 120. Or it can be both of them at the same time, or it can be just one. Either one of those conditions being met is already cause for concern, and you should consult your doctors immediately. So now that we know how we take your blood pressure, why we take your blood pressure, what can be our conclusions regarding this. So as stated a while ago, blood pressure monitoring is very important because it can give you an initial picture of the patient's overall health. Patients who have normal blood pressures, having a high blood pressure can prevent you as a doctor or prevent you as a patient from undergoing different procedures. Why? Because blood pressure indicates the rhythm of your heart. It indicates how your heart is currently functioning at the moment. Having a high blood pressure is having a high blood pressure tells you that this patient will not be able to handle stressful situations, specifically surgeries or even just normal procedures, because it can cause their hearts to either stop functioning, or it can cause their poor blood flow, leading to hypoxia of your organs and stuff. So why is blood pressure monitoring important? On the second bullet, you can see that hypertension can lead to serious health problems. Hypertension can increase your risk or put you at risk for stroke, heart attack, which can and has proven to lead to several fatalities. Hypertension is actually a common problem among the Filipino population, and most of them are unmanaged and untreated. Why? Because some people, usually older people, just chalk it up to stress stemming from a situation that is immediate to them and not an underlying medical problem. So it is important to monitor your blood pressure. Once you see that there's a steady increase, or if there's a consistently high or elevated blood pressure, then it's best to consult with your physicians or your doctors so that they may assess you properly and inform you if there are lifestyle changes that you have to do, or if you have a medical condition that needs to be addressed. So thank you for watching this instructional video. I hope you have learned something and a fitting quote for this specific topic. If there are no ups and downs in your life, it means you're dead. Thank you so much. Bye bye.